Okay, welcome to my autism professional development experience. I hope that the teachers, therapists, parents, and anyone else listening will benefit from this presentation, and we'll learn a little bit more about autism and what it is, causes of it, and similar things to that and that. Some of the things that I'm going to be discussing is what actually is autism, the definition of autism, the changes in the DSM classifications, the causation or etiology of autism, the prevalence and who can be autistic, characteristics of autism and symptomology, sensory difficulties associated with autism spectrum disorder, possible treatments and interventions, and also those that are not validated. Special education, possible jobs and the future for autism, possible jobs for people with autism, and fun facts. And then I have a page of references for you if you want to learn more about it and do some research on your own. So a common question amongst people in the society, and those who aren't educators, or even some people who are educators and teachers and are unfamiliar with a lot of special education cases, or just special education in general, and those classifications of being in special ed. What is autism? So, I have a couple different definitions, one according to the DSM-5, listed at the top, one according to a Netflix movie called Autism in Love, and then one taken directly from IDEA, the definition of a child with a disability, specifically autism. One thing about the definition of autism is that it has remained relatively constant over time, while the symptomology observed over 50 years ago is the same as it is today, with just roughly a couple tiny tweaks and changes. But overall, the same things we've observed in the past, when a TARD who was first observing people with autism, is the same as what I would observe in my own classroom today. Same types of symptoms, same behaviors, and that kind of things. So the DSM-5, I think, is the easiest to follow if you know all the educational terms. If you're unfamiliar with a lot of the terminology, Autism in Love, I loved their definition. And they say that autism is a developmental disorder present from early childhood and characterized by difficulty in communicating and forming relationships with other people, and in using language and abstract concepts. And then also mentions how it's now considered an autism spectrum disorder. So it's ASD instead of just someone who is autistic. And then with the DSM-5 definition, they are more specific on what types of communication people with autism struggle with. So they exhibit nonverbal communicative behaviors, have trouble with social interactions and developing friendships, and also maintaining that friendship and kind of understanding the differences between certain relationships, such as a relationship between a child and their parents, a relationship between a student and a teacher, and just a friendship relationship in general. So all those types of things are confusing. Then moving on from the definitions, I wanted to explain to you what the DSM-5 is, and then as well as the changes that have been made in the DSM-5 in recent years. So DSM stands for Diagnostic and Statistical Manual of Mental Disorders, and it is a book outlined and created by the American Psychiatric Association. This book is used for clinical purposes, and it determines how the diagnosis of autism is made, So it is mostly used by psychiatrists, doctors, and psychologists. So some of you might use it often. However, even though teachers don't use the book very often, we should still be well aware of the contents inside of it and how the psychiatrists, doctors, and psychologists do use it, because it can pertain to our own students and determining whether we think someone should be screened and tested to see if they have symptoms of autism. So if someone who isn't already determined with having autism, they're showing those types of symptoms. Having knowledge of this will allow us to better understand and observe our students and know why they're doing what they're doing. So the DSM-4 is the previous model that was used before our current understanding. In the old criteria, there were 5 different disorders, all under the pervasive developmental disorder header. And that included autistic disorder, Asperger's syndrome, Rett syndrome, childhood disintegrative disorder, and PDD-NOS, which some you still may hear those words and terminology when looking at IEPs or just dealing with your own students if they're a little older, because one can become very attached to their quote-unquote label, and they might want to stick with that same terminology. They've been familiar with it all their lives, so they might still use it themselves or in their paperwork, which is completely okay. So just be kind of mindful of that you might not be seeing ASD or autism spectrum disorder all the time, and you might be hearing some of those words more frequently. And just knowing how they kind of correlate into the new DSM-5. Along with the old DSM, a child had to exhibit 3 symptoms, which were impairment in social interaction, impairment in communication, and repetitive and restrictive behaviors. So the changes that we now use, which are on the right side of the screen, we have a new category heading. So instead of pervasive developmental disorders, we use the terminology of autism spectrum disorders and ASD as the acronym. We have new symptom categories. So instead of having 3, we have 2, only 2 symptom categories with more criteria per category. So what that means is that we have deficits in social communication and social interaction, which would be a symptom you would look for when identifying whether a child you're dealing with has autism. And repetitive and restricted behaviors. So repetitive, you should know what that means, doing things over and over again, and restrictive behaviors, so just having trouble complying and doing socially acceptable behaviors easily. And so those are all symptoms that you would look for, and look for even your child who has autism having those symptoms when you're not just trying to identify. And then learning how to work with those behaviors and adapt them if you are dealing with someone who has autism. Along with the new DSM-5, they added unusual sensory behaviors to the criteria. That is something that is specific to autism. Having hyposensitivity or hypersensitivity, to certain environmental stimuli and resulting in what they call a sensory behavior. So due to something in their environment causes them to then act a certain way, behave a certain way, and that's kind of the new addition to the new classification of autism. Along with the new DSM-5, it folds all the subcategories that were once previously listed as autistic disorder, Asperger's syndrome, into one diagnosis of ASD, and along with that, we have severity levels. So everyone who was previously listed as having Asperger's syndrome now has autism spectrum disorder and might be a level 1 because their severity levels of showing symptoms is very low, while someone who had autistic disorder previously has autism spectrum disorder and might be a level 3, a very severe symptoms. Moving on to the causation or etiology, one of the most common questions asked is, what is the cause? And just to throw it completely out there, there is no known cause for autism at the moment. And this is something, while the symptomology is consistent, the causation and determining between different agencies and professions, we all kind of have different ideas of what the cause for autism is. It has been inconsistent across time, and along with the prognosis for those on the spectrum and treatment for the disorder. Those are things that have been inconsistent about what it is and what type of treatment will work best. So the pseudoscience that you can see there on the left, or the fake news, are basically examples of past examples and theories of what people thought the cause for autism was. When later, after evidence-based research was involved, they were proven false and inaccurate. So the first, we have refrigerator mothers, and that was a claim saying that mothers being unloving toward their children caused their children to then have autism, which is kind of a crazy and skeptical thing to say about a mother. So that was proven to be untrue, and I'm sure those mothers love their children dearly. Another pseudoscientific example of the cause of autism would be childhood schizophrenia. Doctors in the past thought that children with autism only had autism as an effect of being schizophrenic, and after looking into that and studying the symptoms of schizophrenia along with the symptoms of autism, it was proven to also be false and fake news. They do not correlate with each other in any way. Later on, there were claims that vaccinations caused autism due to the lead thimerosal in the MMR vaccine, and the MMR stands for mumps, measles, and rubella, which led to a huge nationwide scare and the prevention of people getting vaccinations amongst the population because they thought that it would in turn cause their child to be autistic. That was also disproven, and since then the vaccinations have become a lot cleaner. However, the lead thimerosal was not the cause of autism, nor did it cause a leaky gut, at which it claimed, with toxins getting into someone's stomach is what they claimed, and that is why the person became irritated, and that resulted in symptoms similar to autism. Untrue. Another claim is environmental toxins, genetically modified food, gluten in our bread, and sometimes even casein, they claim, is a cause, and that's a current one that people still do believe in. And then other pseudoscientific ideas or theories is that autism can be cured. Saying that autism can be cured can be highly offensive to not only the autistic community, but those who have autism themselves. They claim that their autism is a part of them, it is their identity, and to say that it can go away and needs to be cured makes it sound as if it is a bad thing, and it can be just hugely offensive because they like themselves, they're proud of what their abilities are, and to say that you can cure it is simply ridiculous. So if you've previously heard that, you need to veer away from that type of thinking. Now, with our current evidence-based findings, we know that autism is a neurological developmental disability that varies in symptomology and severity. We have